stick with me, Sheila Cheptoyek, and we are still with Dr. Seggane Musisi. So doctor, what are the types of bipolar?
That's a very technical question because in medicine it means I should now classify. Generally, we say things can be primary or secondary. Primary means that the cause is from within or from without. Nothing, you don't know the cause. Chemical imbalance, genetic, those are primary. Secondary means that you can identify the cause. For example, we know that certain chemicals that people may take can get their moods to swing, So that is due to drugs. Secondary to drugs, secondary to infections like HIV, secondary to cancers like certain cancers in the brain. But primary means it is coming from without. So let's talk about the primary one because that's the one which is most common.
Okay.
It can be familial, but then it can be, we can also classify it according to degree. Is it small degree or minor? Is it major? So you can speak of, for example, a personality that goes up and down, and we can say cyclothymic.
Okay.
Or you can say bipolar, but not so severe. Not manic, but hypo, meaning low, hypomanic. So we can say bipolar 1, which is really severe mania, or bipolar 2, which is small mania. Or small depression or big depression. That's using lay terms, that's what I would like to call it. I don't think it's a good idea for us to go into the technical classifications. That will be too much. But just know that the secondary ones can be prevented by not acquiring those things secondarily that go to cause it. For example, if I say avoid drugs and alcohol abuse, take care of mothers so that they don't break down after delivery.
After delivery, yes.
That means that we can do some prevention there.
For the secondary.
For the secondary. The primary ones just tend to come from without. And we just look after it after it has manifested.
So is it possible for somebody, first of all, does it heal bipolar?
There's what we call a natural history. Again, let's differentiate between primary and secondary. For the second ones, it depends on what has caused it. For example, you stop abusing drugs, your bipolar goes away. You treat HIV properly, you're likely the one related to HIV will not manifest. But the primary one, you have to manage the condition as it comes. And depending on the natural history in the individual, some are severe, like all kinds of illnesses, medical illnesses. Some are not so severe. It's just like cancer. If you treat cancer very early on, you may cure it. Later on, it may not be able to be cured. You do other things to try to lower the impact. So the same thing with bipolar disorder. If it's minor, you can treat with a bit of counseling and and drugs. If it is major and recurrent, it means that you have to give medications, including prevention of relapses. And it becomes incumbent on the patient, on the individual, to keep coming back to take medications to prevent relapses. It's lifelong. That's important to know. There are many illnesses in medicine that are lifelong. I'll wear these glasses until I die. It's a lifelong illness. It does not mean it's a curse. It just means that it's nature. Yes.
So the nature of bipolar is it's lifelong.
It's a lifelong illness.
For the primary.
With different degrees of severity.
Are there people who are more prone to bipolar?
Yes. People have a family history of mood disorders, depression, mania, things like that. They tend, that is a familiar type. They're prone. Like I said earlier on, if you're an identical twin and your identical twin has it, there's a 70% chance
that you also have it.
If a first degree relative has it, you have a high degree of having it. If a second degree relative has it, you have a 10% chance. First degree relative, up to 40%, something like that. Maybe more importantly is to recognize that is this tendency for it to come in early youth, when you're starting your careers or when you're in school. that becomes very important because it may disrupt your school. It may limit your potential for the future if not managed properly. So it becomes very important to try to manage it very properly so that we do not affect other situations in your life.
Yes, yes. So I'm looking at cases like trauma, let's say a death of a loved one or situations that really cause trauma. Is this one lifelong as well when somebody gets bipolar because of prolonged trauma?
Certain traumatic experiences can trigger mental illnesses, including bipolar.
Yes.
But that's rare. Just like they can trigger any psychosis or a depression or something like that. So this can also be triggered. But life is full of traumatic experiences.
That's true.
Again, trying to avoid traumatic experiences like war, domestic violence, corporal punishments, things like that, sexual abuse of children. These things are very important for good mental health, to avoid them.
So there are things we can do as individuals to actually avoid cases of mental health. Yes,
of mental illness.
Of mental illness.
We'll provide something to improve mental health.
Okay. So that means that maybe as a family, you actually need to watch out for situations, taking care of the children. So that
parenting.
Sexual exploitation.
No sexual abuse, no incest, things like that. No abuse of children, no abandonment of children. It becomes very important. Yes.
And it helps in our mental health.
Yes.
Okay. So doctor, what is the difference between psychosis and bipolar disorder?
Okay. If you go to look under psychotic illnesses, you'll see bipolar being listed in them. In other words, psychosis is a much broader term, which means a disturbed reality testing, a disturbed way of relating to reality. And that is psychosis. People hear voices, we call them hallucinations. People have delusions, fixed false beliefs.
Yes.
People cannot relate to others in a realistic manner. Bipolar illness, when active, can become psychotic. For example, one can have beliefs that they're super intelligent, or super rich, or super powerful. They are going to be presidents. They are going to be to rescue the world. They are going to eradicate poverty on earth. They are going to find cures for AIDS. Things like that. We call those grandiose. On the other hand, when they're depressed, they may feel they're worthless, useless, hopeless. They deserve to die. And then they even begin to hear voices telling them to kill themselves. That is depressive psychosis. So the extremes of bipolar can become psychotic.
Okay. What is the line between somebody who is actually hopeful, a dreamer, and hopes to achieve great things in life, and somebody who has now gone overboard? Yes.
So that's what I meant by reality testing. The psychotic is not in keeping with the reality. A dreamer is in keeping with the reality. So I'll go to school, achieve good grades, go in a profession, become a lawyer, become a doctor, become an engineer, become a nurse, become this. But on the other hand, you find somebody who is not going to school or who is failing in class, saying that suddenly they're going to become lawyers tomorrow, or suddenly they're the presidents of the country. They are not working, they have not worked for a year, suddenly thinking they have $1 million shillings or $1 million on their account. They are not in keeping with the reality. So the psychotic is not in relation to reality. Their reality testing is not there.
Okay, so we would be able to tell when we check with reality.
Yes.
All the time.
Yes. That those who are having unrealistic things and believing in them, and they cannot be shaken from realizing that those are not reality. Those are the ones that you say are psychotic. They're not in touch with reality.
Okay.
Yes. The most important thing is to know that mental illnesses can be managed in hospitals. Bipolar affective disorder is known by doctors. We know the signs and symptoms. We know the causes. We know the associations. We know the treatments, psychological, social, and medical, or pharmaceutical. We have the medications we can treat. We also have ways of advising people on prevention, you know. For example, avoiding drugs and alcohol,
yes.
avoiding extreme stresses in your life, avoiding traumatic situations, you know, things like that. These things are known. And avoiding certain infections like HIV. These things are known, and we can advise people.
Okay.
And when it has manifested, we know how to treat it and how to mitigate deterioration. That's important for people to know.
Okay.
And to know that our hospitals are equipped with treatment and that people specialize in them. That's why I'm a psychiatrist.
Yeah.
And we treat them, including here at Entebbe Lakeside Hospital.
Yes.
Yeah, and the other hospitals throughout Uganda. We have put in programs in primary health care, health center 2, 3, 4, 5, you know, up to tertiary, you know, of treating mental illnesses, including bipolar disorder. And I would like people to know, not to be fooled, that these things are caused by supernatural forces, demons, witchcraft, maginis, and things like that. Yeah. These things are not true, okay? These are illnesses that can be managed. And we look forward to receiving people and helping them.
Sure. Yes. Thank you so much, Doctor, for creating time for us.
Thank you.
And for such informative session we've had with you. Thank you so much for watching. This has really been informative, and I hope that somebody out there has learned 1 or 2 things from our session today. And so if there is any questions that you would like to ask, please leave them in the comment section, and also share the video with some of your friends. Do not forget to subscribe as well, and click that notification button for more videos. Thank you.